Yes, gas can cause back pain, and not just mild discomfort. For a lot of people, trapped gas creates a deep, intense aching in the lower or mid-back that feels completely unrelated to digestion. They stretch, they take painkillers, they worry about their spine, and nothing works because the problem isn't the spine at all. It's gas pressure building up inside the gut and pushing against the surrounding muscles and nerve. In this video, I'm going to explain exactly how gas causes back pain, what's driving the gas buildup in the first place, and the specific steps you can take to get relief fast and stop it from coming back. Let's get straight into it. How gas causes back pain. Most people think of gas as a stomach issue, bloating, discomfort, passing gas. But trapped. Gas doesn't just stay in one place. Your digestive system is a long winding tube that runs through the center of your body, closely surrounded by your abdominal muscles, your diaphragm, and your lumbar spine. When gas gets stuck and builds up pressure, it pushes outward in all directions. That outward pressure presses against the back wall of your abdomen, compressing the muscles that run alongside your spine. It irritates the nerves in that area and can even cause the surrounding muscles to go into spasm. The result is a real physical ache in the lower or mid-back that has nothing to do with a disc, a muscle strain, or a spinal problem. Here is what makes this particularly confusing. The pain from trapped gas in the colon can move around as the gas shifts position in your gut. It can feel like it's coming from deep inside. The lower back one moment, then shift to the left side, then the right side, then ease off entirely when the gas passes. This shifting, unpredictable quality is actually one of the key signs that gas is involved. Common causes of excessive gas buildup. Understanding why your body is producing excess gas is the first step to fixing it. Here are the most common causes. Number 1. Swallowing air. Every time you eat too fast, drink through a straw, chew gum, or talk while eating, you swallow air along with your food. That air has to go somewhere. Some of it gets absorbed, but a significant portion travels through your digestive tract and becomes trapped gas. People who eat quickly or drink carbonated beverages regularly are often producing far more gas than they realize and feeling it in their back. Number 2. Gas-producing foods. Certain foods are well known for producing large amounts of gas during digestion. Beans and lentils, cruciferous vegetables like broccoli, cabbage, and cauliflower, onions, garlic, dairy products, especially in people with lactose sensitivity, whole grains, and apples are among the biggest culprits. These foods contain carbohydrates and fibers that your small intestine cannot fully break down, so they pass into the large intestine where bacteria ferment them, producing gas as a byproduct. Number 3. Irritable bowel syndrome. IBS is one of the most common digestive conditions affecting a significant portion of the population. People with IBS have a hypersensitive gut, meaning the intestines are more reactive to normal amounts of gas and movement. Even ordinary levels of gas create exaggerated pain signals which can radiate directly to the lower back. If you regularly experience bloating, gas, alternating constipation and diarrhea, and back pain together, IBS is very likely part of the picture. Number 4. Constipation. When stool sits in the colon for too long, the bacteria in your gut continue fermenting it and producing gas. That gas has nowhere to go. It builds up behind the blockage, creating intense pressure that pushes against the back wall of the abdomen. Constipation-related back pain often feels like a dull, heavy ache in the lower back that doesn't improve with stretching or movement and disappears shortly after a bowel movement. Number 5. Food intolerances. Lactose intolerance and gluten sensitivity are two of the most widespread food intolerances, and both cause excessive gas production when your body cannot properly digest lactose from dairy or gluten from wheat. The undigested particles reach the large intestine and undergo heavy fermentation. The gas produced can be intense, painful, and frequently felt in the back. Many people go years without realizing a food intolerance is behind their chronic bloating and back pain. Number 6. Gut bacteria imbalance. Your gut is home to trillions of bacteria that play a vital role in digestion. When the balance of these bacteria is disrupted by antibiotics, a poor diet, chronic stress, or illness, harmful gas-producing bacteria can overgrow. This condition is sometimes called SIBO, or small intestinal bacterial overgrowth. It causes persistent bloating, excessive gas, and a constant, dull ache that often radiates into the back and sides. Number 7. Sedentary lifestyle. Movement is one of the primary drivers of healthy gut motility, meaning how efficiently food and gas move through your digestive system. When you sit for most of the day, gut motility slows dramatically. Gas accumulates in the intestines instead of moving through and out. This is why people who sit at a desk all day are far more prone to gas-related back pain than people who stay active throughout the day. How to tell if your back pain is caused by gas. Before treating anything, it helps to confirm that gas is actually the source of your back pain. Here are the clearest signs. The pain came on after eating. If your back pain consistently appears or gets worse within 30 minutes to 2 hours after a meal, gas is almost certainly involved. This is the time frame when food reaches the large intestine and fermentation begins producing gas. The pain shifts or moves. Gas-related back pain rarely stays in one fixed spot. As gas moves through the colon, the pressure shifts, and so does the location of the pain. One moment it's on the left side, then the right, then lower. Spinal or muscular back pain tends to stay in one consistent location. The pain eases after passing gas or having a bowel movement. This is the most reliable sign if your back pain noticeably reduces or disappears after releasing gas or having a bowel movement. The cause was gas pressure. This connection is direct and unmistakable once you start paying attention to it. The pain is accompanied by bloating or a distended stomach. If your abdomen feels hard, swollen, or visibly larger than usual alongside the back pain, trapped gas is almost certainly the cause. Bloating and back pain appearing together are a very strong combined signal. Exact solutions: how to get rid of gas-related back pain. Here are the specific steps to get relief quickly and prevent it from returning. These target the gas directly, improve gut motility, and release the back muscles affected by the pressure. Fix 1. The gas relief yoga poses. These specific body positions physically move trapped gas through the intestines and out of the body. Do them in sequence for maximum effect. The wind-relieving pose. Lie flat on your back. Pull your right knee to your chest and hold for 30 seconds, pressing it firmly against your abdomen. Release and repeat with the left knee. Then pull both knees to your chest together and hold for 30 seconds. This compresses the ascending and descending colon, pushing trapped gas along its path. Child's pose. Kneel on the floor, sit back onto your heels, and extend your arms forward on the ground, lowering your chest toward the floor. Hold for 60 seconds. This position compresses the abdomen and creates a gentle massaging effect on the intestines that encourages gas to move. Supine twist. Lie on your back, pull your right knee to your chest, then let it fall across your body to the left while keeping your shoulders flat on the floor. Hold for 30 seconds per side. The twisting motion of the torso directly massages the colon and helps move stubborn trapped gas. Do this full sequence whenever gas pain strikes. Most people feel relief within 5 to 10 minutes. Fix 2. Abdominal massage. This is one of the most effective and underused tools for gas relief. Lie on your back with your knees bent. Using the flat of your hand, apply firm but gentle pressure and massage your abdomen in a clockwise direction, starting at your lower right side, moving up to the right side of your rib cage, across the top of your abdomen, down the left side, and across the bottom. This follows the natural path of your colon. Do this for 5 minutes using slow, deliberate circular strokes. The clockwise direction is critical. It moves in the same direction as your digestive flow, pushing gas toward the exit rather than back the wrong way. Do this every time you feel gas-related back pain and before bed. Each night if bloating is a recurring problem. Fix 3. Heat on the abdomen and lower back. Heat relaxes the smooth muscles of the intestines, reducing spasm and allowing gas to pass more easily. Apply a heating pad to your lower abdomen for 15 minutes, then move it to your lower back for another 15 minutes. The heat on the back relaxes the muscles that have tightened in response to the gas pressure, providing direct relief from the back pain, while the abdominal heat speeds gas transit. Fix 4. Peppermint tea. Peppermint contains a compound called menthol that has a direct antispasmodic effect on the smooth muscles of the digestive tract. It relaxes the intestinal walls, allows trapped gas to move more freely, and reduces the intensity of gut cramping. Drink 1 to 2 cups of peppermint tea after meals or at the first sign of bloating and gas pain. This is one of the most well-researched natural remedies for gas and IBS symptoms, and it works quickly. Fix 5. Walk after every meal. A 10 to 15-minute walk after eating is one of the most powerful things you can do to prevent gas-related back pain. Walking stimulates the muscles of the digestive tract through physical movement and gravity, accelerating the transit of food and gas through the intestines before pressure can build up. Make this a non-negotiable habit after every meal. People who walk after meals have significantly less bloating and gas pain than those who sit or lie down. Fix 6. Identify and eliminate your trigger foods. Run a simple 2-week elimination trial. Remove the most common gas-producing foods from your diet completely: beans, lentils, broccoli, cauliflower, cabbage, onions, garlic, carbonated drinks, and dairy products. Pay attention to how your gas levels and back pain respond. After 2 weeks, reintroduce one food at a time every 3 days and observe your reaction. This process will clearly identify which specific foods are driving your gas production. Once you know your triggers, you can either avoid them entirely or use digestive enzymes before eating them to reduce the gas they produce. Fix 7. Improve your gut bacteria. A healthy balance of gut bacteria produces significantly less gas and processes food more efficiently. Add a daily probiotic supplement containing lactobacillus and bifidobacterium strains. These have the strongest evidence for reducing bloating and gas. Alongside the supplement, add probiotic-rich foods to your daily diet. Plain yogurt with live cultures, kefir, sauerkraut, or kimchi. Also increase your intake of prebiotic foods. These feed the beneficial bacteria. Oats, eat bananas, asparagus, and garlic in small amounts all support healthy gut flora. Within 2 to 4 weeks of consistent probiotic use alongside dietary changes, most people notice a significant reduction in gas production and bloating. Fix 8. Change how you eat. Slow down. Chew every bite thoroughly. Aim for 20 to 30 chews per mouthful. This pre-digests food more completely in the mouth, reducing the workload on your intestines and cutting down on fermentation and gas production. Avoid talking while eating, stop drinking through straws, and eliminate carbonated beverages entirely if gas is a regular problem. These simple changes reduce the amount of air you swallow with every meal. When to see a doctor. Most gas-related back pain responds well to the solutions above. However, you should see a doctor if you experience any of the following: back pain and bloating that persist for more than 2 weeks despite dietary changes and the remedies above; unintended weight loss alongside bloating and back pain; blood in your stool or a significant change in your bowel habits; severe abdominal pain that comes on suddenly and does not ease; bloating and back pain that wake you from sleep. These can be signs of conditions like inflammatory bowel disease, celiac disease, or in rare cases, more serious digestive conditions that require medical evaluation. Your simple daily routine for lasting relief. Follow this routine consistently for 30 days and you will see a dramatic reduction in gas-related back pain. Every morning, drink a large glass of warm water with fresh lemon juice on an empty stomach. This stimulates gut motility and gets your digestive system moving early. Follow with a cup of peppermint tea if bloating is a regular issue for you. At every meal, eat slowly, chew thoroughly, and avoid carbonated drinks. Do not lie down or sit still after eating. Take a 10 to 15-minute walk instead. Every evening, do the 5-minute clockwise abdominal massage followed by the gas relief yoga sequence, wind-relieving pose, child's pose, and supine twist. Apply a heating pad to your lower abdomen and back for 15 to 20 minutes. Every day, take your probiotic supplement, avoid your identified trigger foods, and make sure you are getting at least 2 to 2.5 liters of water. Hydration keeps stools soft and moving, which prevents gas from getting trapped behind a constipated colon. Every hour during the day, stand up and move for 2 to 3 minutes. Do not let yourself sit for more than an hour at a stretch. Sedentary periods are when gas accumulates and pressure builds against your back. Stick to this for 30 days. The combination of dietary changes, movement, gut support, and direct gas relief techniques will address the root cause, not just the symptom. That's everything. Exactly how gas causes back pain, what's driving the gas buildup, and the specific steps to get rid of both. If this video helped you finally make sense of what's going on in your body, hit the like button and subscribe for more practical back pain solutions every week. Drop a comment below and tell me, does your back pain tend to get worse after eating? I'll reply and help point you in the right direction. I'll see you in the next one.